Hi everyone, welcome to this video. In this video I'm going to explain with some simple math why we need testing in the case of the COVID-19 virus. There are many people that say that we don't really need testing, and we've had people say that for as long as the disease has been around, and it's just that the reason why they're saying that has changed. Early on in the disease, many people said, well, the disease is not in our area yet, so we don't really need to test yet. Once we start having cases, then we need to start doing tests. And then when there were cases, then people were saying, well, there are cases, but these are all people who traveled abroad. They got the disease somewhere else, and then they brought it here, so we don't really need testing because there's no community spread happening yet. And by now, most people are not saying that anymore, but now more and more people are starting to say, why do we need to do testing when we have a lockdown? We're doing social distancing. We're not getting in touch with each other. Why do we still need testing? It's not going to make a difference anyway. I'm going to explain in this video with some simple math that all of these arguments are flawed. With my own province, the province of Quebec in Canada, which is located just north of the state of New York, and it shares a border with the state of New York. And the figure that you can see here, the chart, shows you the number of cases, positive cases for COVID-19 in the province of Quebec as a function of time. Do you see something unusual? I'm sure you do. Up to about day March 22, the spread or the increase of the disease is fairly gradual, and then all of a sudden, bang, a spike. So what's going on there? To be honest, I was actually not surprised when that happened because of the way the disease has been handled up to March 22. So it happens a friend of mine was tested for COVID-19 on March 19th, so on this day, when there were about 120 positive cases in the province of Quebec. He showed symptoms of COVID-19, he went to get a test, and he was tested. And the test, fortunately, was negative. He does not have the disease, but it was explained to him that they weren't actually surprised that he didn't have the disease because he hadn't traveled abroad. And they were claiming so far there were no cases of community spread in Quebec. Therefore, he couldn't have had the disease. Now, when I heard that, I was a little alarmed because I knew that could not be true because of reasons that I will explain in a minute. And so when that spike came, I was not entirely surprised, unlike many other people. Let's take a closer look at that statement. There is no community spread, as it was thought on March 19 in the province of Quebec. How likely is it that that was true? What are the chances, really, that there was no community spread at that time with 100 cases? To do that, we need to make a number of assumptions to help us make calculations. And the assumptions that I'm going to make are the following. Let's assume that there were indeed 100 cases in the province of Quebec as of March 19. Let's assume that these were indeed people that had traveled abroad, arrived in Quebec, and let's assume that on average, 2 days after arriving in Quebec, they got sick and they got tested. And then thirdly, let's assume that each of those people who were carrying the virus had a 10% probability of spreading it every day that they had the virus undetected. Now we know that the disease has an R0 of about 3. In other words, on average, every person who carries the disease spreads it to 3 other people. So it's very unlikely that there is only a 1 in 10 chance that people are spreading it to someone else in any given day, because in that case they don't really have the time to spread it to 3 other people. But we'll go with very optimistic assumptions, and then we'll see where the calculations lead us. So these are the assumptions. If I put the two first assumptions together, we get that there are 200 days worth of spreading that could potentially have happened. If we look at the third assumption, that tells us that there is a 90% probability that the disease is not being spread by any given person with the infection on any given day. We say that P equals 0.9. P stands for probability. So that's the event that we're looking at, the event of not spreading the disease by an infected person on a day. For there to be no community spread, we need to have 200 such events happening in a row without exception. What are the chances of that happening? Now, the chances that something happens 200 times in a row is a probability of that event to the power of 200, which is 1.4 times 10 to the minus 10. In other words, there is 1 chance in 7 billion that there is no community spread as of March 19 in the province of Quebec. So for all intents and purposes, it is impossible that there was no spread happening, and people who were in charge of making these decisions should have known that. Okay, let's go to the next question. Do we need to test now that people are social distancing anyway? You could say the disease is under control or should be under control anytime soon because we're no longer spreading it. Let's take a closer look at that. Do we really need testing when we're going to practice social distancing anyway? Let's assume before social distancing we have a basic reproduction number of 3 for the disease. What that means is every person who's infected infects 3 additional people, who then each infect 3 people also, and so on, until, in principle, this can go to infinity, mathematically speaking, or in practice, until either the entire population is infected, or until the R0 drops below 1. So let's assume that we do get a lockdown, and let's assume that the lockdown is 75% effective. So that means we'd bring the R0 down to 0.75, which is 1/4 of 3, which would be a fairly good success because you're never going to get 100% reduction of social interactions. You still need to go to the store to buy food. Some people still need to go to the doctor and so on. So mistakes are going to be made during social interactions. Somebody might forget to wipe down a surface and so on. So are we not going to bring the R0 down to 0? 0.75 would be a fairly good success in a case like this. What does that mean, R0 equals 0.75? Well, that means that every person infects 3/4 of another person, and each of these infect 3/4 of another person as well, and so on, and so on, and so on. So of course in practice you can't infect 3/4 of a person. Either you infect someone or you don't. So let's say we start from 100 people who are infected and who don't know they're infected. Well, they will spread the disease to an additional 75 people, and then those 75 people will infect an additional 56 people, which is 75% of 75, and so on, and the number will grow and grow up to 400, and there it will stay constant. So from 1 person we go to 4 person. In other words, 3 additional people are going to be infected because 1 person doesn't know that they are infected. And it's for those 3 additional people that we need to do additional testing. Because if you know you have the disease, you are going to change your behavior. I mean, we're generally going to try to follow social distancing to the best of our ability when we are under the assumption that we don't have the disease. But when we do have the disease, we're going to pay extra attention. We are not going to be the one who go out and buy food, for instance. we're going to isolate ourselves from our family members. We're going to make sure that we're not in contact, in physical contact with them, and so on. So we are going to reduce the spread if we know we have the virus in comparison with a situation where we don't know we have the virus, even when we are in a lockdown. And that is what this is all about. It could make a difference for 3 people that you would otherwise infect. So what can we conclude from all of this? Well, first of all, we conclude that it is never too early to test. When you think that the disease is not in your area yet, it is worth it to test, because by the time it is obvious that the disease is in your area, you've lost a lot of time and a lot of people will die because of that. Secondly, it is never too late to test. So even when you think the disease is out of control and there's nothing we can do, or the opposite, when you think that the disease is under control and there's nothing that needs to be done anymore, it is still necessary to test because it is still possible to save lives with testing. Community spread that was there in the early stages of the disease could have been anticipated with some simple math and stats calculations and should have been anticipated. And testing of all suspected cases, not just the people who are having symptoms, should be mandatory, including contact tracing. It's interesting. I remember when I was in high school, I lost a classmate due to meningitis. And meningitis is a bacterial disease that's very contagious and is also very deadly. And what happened, this happened during a Christmas break. By the time I came out of Christmas break, everybody who had been in contact with this person had been traced, had been tested, and had been cleared. And this is how it should be with diseases like this. If people who made the decisions understood the math of the spread of the coronavirus, they would be doing this. It's very disappointing that this is not happening. Which brings me to my final conclusion. Public health experts should study math. I hope you find the information in this video useful. If you did, please like the video, please subscribe to the channel, and I hope to see you in the next video.